I'm Dr. Joel Cherdack, president of Denver Regenerative Medicine. Patients call us all the time asking questions about the various types of stem cell therapies that we offer. There's a lot of confusing information out there: bone marrow derived stem cells, adipose derived stem cells, exogenous or umbilical cord stem cells, exosomes. There are all these products and all these different types of stem cells out there. So today I'm going to explain the differences between them. So at our clinic, we utilize many different types of stem cell therapies. First, let me talk about PRP. PRP stands for platelet-rich plasma. Many of you have heard of this before. What it is an extraction of just the platelets from a patient's own blood. So when we do PRP, we do a quick blood draw. We take that small sample of blood, we put that in a centrifuge and spin it down, and we're able to isolate just the platelets out of that sample. For some injuries, like for chronic tendonitis, things like tennis elbow or golfer's elbow, just injecting PRP into that site can really cause great healing. And oftentimes that's all a patient needs to heal those types of injuries. So chronic tendonitis, a ligament sprain or strain, those types of injuries respond very well to PRP. Sometimes a small muscle tear will also respond well to that type of therapy. The next step up, if you will, would be stem cell therapy. So the types of stem cell therapies that we perform utilizing a patient's own stem cells are called BMAC, or bone marrow aspirate concentrate, and adipose-derived stem cells. So let me talk about BMAC first. So bone marrow aspirate concentrate. So these are stem cells that are derived from a patient's own bone marrow. And the way that we collect those is we have a patient laying face down on our procedure table. We numb with lidocaine the area around the bone that you feel that sticks out of the back of your hip that you can feel with your finger. We have a patient laying face down. We take a very thin needle and we go just below the surface of the bone, and we extract about 60 cc's of bone marrow. And we take that bone marrow sample and we put that in a centrifuge and we spin that down at a specific speed for a certain amount of time so that we can isolate just the stem cell layer out of the bone marrow. And that's what we use as part of our stem cell procedure. Another area of the body in which we're able to obtain a patient's own stem cells is from fat, or what's called adipose-derived stem cells. And the way that we perform this procedure is we have a patient laying face up on our procedure table. We make about a 1-inch diameter area of numb skin on the abdomen, and we take a small liposuction-like device, and we use that to extract what would be the equivalent of about a shot glass full of fat. And then we put that fat sample in the centrifuge and we isolate just the stem cells out of that fat sample, and those are what are called adipose-derived stem cells. Now, for many of our procedures, we just use a combination of those three things: platelet-rich plasma, or PRP, bone marrow concentrate aspirate, or bone marrow-derived stem cells, and adipose stem cells. We're one of the few clinics that uses both bone marrow and adipose-derived stem cells. Now, each one of these stem cells has various properties that are slightly different that will affect either cartilage growth, tendon growth, soft tissue or hard tissue. Some of them help with bone growth, but using both the adipose-derived stem cells and the bone marrow-derived stem cells really gives you a synergistic effect for faster and more complete and more long-lasting healing. Now, the other types of products that we offer are products that are called exogenous, or they come from outside of the body, and we use FDA certified laboratories that are licensed to be able to use human biological products as our source for getting these exogenous products. So one of the exogenous products we use is called umbilical cord stem cells. So a lot of people have heard about umbilical cord stem cells. These are stem cells that are derived from donors. So if a mother who's about to deliver signs up with one of these companies, they'll come right when the delivery happens, and they'll take a sample of the umbilical cord that comes out after the birth. So again, we're not hurting any babies. Nobody's suffering from this process. It's just medical waste otherwise that we're utilizing so that we can get the stem cell sample out of that. And then those companies that do that isolate the stem cells from the umbilical cord, package them, and that's what we can use in our procedure. We will recommend umbilical cord cells when we think that the addition of them would be more beneficial to a patient. So a lot of times that's dependent upon a patient's health status. So let's say we have a patient who's over 75 years old, they're a little bit run down, they have severe arthritis. We might recommend that they use just the umbilical cord cells along with their own PRP. In most cases, we suggest that a patient uses a combination of both their own stem cells and these other exogenous agents like umbilical cord stem cells together so that you get the effect of both of them. So your own stem cells are most compatible with your body. They have a longer lasting effect. They provide more tissue growth. Umbilical cord stem cells work much more powerfully because they're brand new cells, but they're not quite as compatible and they don't have as long lasting effect. But for patients whose own stem cells aren't going to be as viable for some reason like a systemic disease or advanced age, the umbilical cord cells are a much better option. And like I said, we can use them in varying combinations, and we work with our patients to determine what the best combination of those cells are going to be. Another final exogenous product that we use are called exosomes. Now, many people have heard of exosomes, but they don't really understand what they are, and some explanations can be quite confusing, so I'm going to try and make it as simple as possible. What exosomes are chemical signals that are released from stem cells that signal other cells to grow and proliferate and create more tissue and less inflammation. So they're just packets of information. And the reason that they're called exosomes, so exo meaning outside of, zome meaning a fat package. So what they do is as they leave the stem cells, they take a little piece of the cell membrane with them, and that encapsulates the messenger. And the messenger is just a protein that's created by the stem cells to signal growth in other cells. So we have companies that we work with that isolate just the exosomes from a culture of stem cells, and they can isolate them, and they're sterile, they're certified to be effective. We only, like I said, work with compliant laboratories to get these products. And what exosomes do is they really accelerate the healing process. So you get a much faster result with exosomes. So oftentimes we add exosomes to our stem cell therapy procedures in order to get faster healing. So whereas stem cells themselves might create a situation where you're feeling the effects of it 3 to 4 weeks out, the exosomes speed up that process to where you can be feeling the effects of the procedure within days, and then the effects of the stem cells thereafter. So we can use all these products in different combinations depending on what we're treating, depending on the severity of the arthritis or of the degeneration or of the ligament or muscle tear or of the cartilage damage, whatever the case may be. We can match the condition with the exact protocol for the type of stem cell therapy that would be the most appropriate and produce the best result. So again, this is different than other clinics. Other clinics often offer just the exogenous product because they don't have a board-certified medical doctor on staff that knows how to do these painless extraction procedures. And a lot of clinics don't have the 12 years of experience that we do working with these various biological products to see what the results have been, and therefore use our experience to best consult with the patient and let them know what we think the best outcome will be based upon the protocol that we recommend. If you have any questions, reach out to Denver Regenerative Medicine, and one of our patient coordinators would be happy to speak with you and answer any of your questions.